Good afternoon, friends, and we are back again with our Facebook Live session, and we are with Dr. Debashish Roy, consultant at Apollo Gleneagles Hospitals, Kolkata. And today's topic, what is hernia and what are its different types? Good afternoon, sir. If we can just brief the audience about what we'll be discussing today.
Today we'll discuss about a very common problem, which is hernia, and where it happens, why it happens, what are the symptoms of hernia, what are the problems that can one face with a hernia, and what is the treatment.
Right. So the first question, the basic question that everybody has who has not faced this before is, what is hernia?
Okay. Now, to understand the hernia, one must first understand what is the structure of the abdomen. Now, the abdomen, as we say it, is the part of the body which is between the rib cages on the top and the groin below. This area, when we look at it from the outside, all we are seeing is skin with a dimple in the middle, which is called the belly button. Medically, we call it the umbilicus. Now, below the skin or beneath the skin is a variable thickness layer of fat, and below that is a thick wall of muscle. Now, this muscle is very important because this muscle encases all the contents of the abdomen, such as the liver, the kidneys, the intestines. So it acts as a protective shield or a barrier from external injuries, and it keeps the shape of the abdomen. So if the tone is good, we have a flat abdomen. If the tone is bad, we have what is called a paunch or a belly. Now, this muscle, if one can imagine that due to some reason a defect happens in the muscle, by defect I mean a hole happens in the muscle, then what might happen is part of the abdominal content, say for example the intestine, a part of this intestine may then come out through this hole and lie above the muscle or outside the muscle in the fat layer. So a part of the intestine is inside and a part of it is outside. This is what we call a hernia. But I must add that the structure that is coming out through the hole is by itself a completely normal structure. There is no disease in the intestine that is coming out. It is just that part of it is inside and part of it is outside. So this condition is called a hernia.
So if we may ask, what causes a hernia to form?
Okay. Now, as I said before, that there has to be a hole. So without a hole, there cannot be a hernia. So that is fundamental. But there is a second very important thing. That is, we need a driving force that actually pushes the contents out through the hole to the outside. And this driving force is an increase in the pressure inside the abdominal cavity. And what are the common causes that increases the pressure inside the abdominal cavity? People who have chronic cough, say asthmatics, people who have COPD, that causes increase in intra-abdominal pressure. People who have to strain to pass stool, people who have to apply pressure to pass urine, they have increased intra-abdominal pressure. If there is a new tumor or a growth or a cancer inside the abdomen which is occupying space, may increase the intra-abdominal pressure. Along with this, if the muscle is weak, how can a muscle become weak? People who are overweight, the muscle gets stretched, thinner, and becomes weak. Post-pregnancy, when the muscles get stretched, the muscles become weak, then also they can cause hernias. And the other common reason for the muscles becoming weak is somebody has had surgery. They have had a cut which has been stitched up, there's a scar, and that scar is definitely weaker than the rest of the normal abdomen, and that can lead to a hole and cause a hernia.
So what are the places in the body where hernia can occur?
Well, hernias can occur almost anywhere. In the abdomen, it is extremely common. But before I start to tell you the places, I must mention that there are certain holes or defects in the muscle, as we talked about, by birth. All of us have it. The commonest sites are the two groins. We have holes on either side, which all of us have by birth, and they serve an important purpose, why those holes are there. But unfortunately, it also leads to hernias. And the hernias that happen in the groin through these holes are called inguinal hernias, and by far that's the commonest variety of hernias that we see. The other weak point by birth in the abdomen is the belly button, which we call the umbilicus. So a hernia happens through the umbilicus, which we call as an umbilical hernia. Hernias may happen in the part of the abdomen above the belly button up to the rib cage. That area is medically called the epigastrium, and therefore the hernias that happen in that side is called the epigastric hernias. Similarly, hernias may happen in the back of the abdomen where the kidneys are, and they are called lumbar hernias. More importantly, people can get hernias if they have had previous operations. So if they have had an operation for appendicectomy, they have had an operation to remove the gallbladder, and they have a scar. These areas almost always become weaker than a normal abdominal wall, and therefore hernias can happen through these scars. And depending upon where the scar is in the abdomen, the hernias can occur anywhere, and these hernias are called incisional hernias or ventral hernias.
How does one recognize hernia formation?
Right. Now, the first symptom that patients usually have is that they feel a swelling under the skin, which was not there before. It's a soft swelling. Once the hernia starts growing bigger, and by bigger I mean more and more contents are coming out through the hole, it actually then becomes visible as a bulge wherever the hernia is. Characteristically, at least in the initial stages, when there is a free ingress and outgress of the contents, that means the contents can go in, go out by themselves and return by themselves, patients usually find that when they are lying down, when the contents go back into the abdominal cavity, the swelling disappears or the swelling becomes less. And when they stand up or when they do some work or exercise, more and more contents come out, and therefore the swelling increases. So not only the presence of a soft swelling or a bulge, but it reduces in size on lying down and increases on size when they are working or when they are vertical. This is the commonest symptom. As time goes by and more contents are coming out through a relatively small hole, there might be some amount of pressure because there are too much contents through a small hole, and at that stage the patient might feel pain.
Right. And this sounds very dangerous. Is it dangerous?
Well, good question. I think majority of the hernias are not dangerous. And to understand why it can be dangerous, again, if you go back to the last question, that is when there is a free coming out, free return, then usually it is not dangerous. However, as time goes on and more contents come out and the hole then becomes small compared to the volume of the contents that have come out, then the contents may get stuck. By the word stuck, I mean then there is no free movement across the hole and they get stuck. And when they get stuck, they can cause pain. And that is where the trouble starts, because as more and more contents come out, the hole then proves too small. And if it is intestine, then this squeezing of the contents can actually cause the lumen of the intestine to become narrower and narrower till a time comes when it is completely obstructed, and then this condition is called an obstructed hernia, and the patient may then develop severe abdominal pain, vomiting, the abdomen gets swollen up, and then it becomes an emergency situation. When it worsens, even after this, the blood supply of the hernial contents may get compromised, again because of the excess pressure and the squeezing. And this then becomes very, very dangerous, because once the blood supply is cut off, the part of the hernia that is outside the muscle then starts to become gangrenous. And this is called a strangulated hernia. This is extremely serious, this is life-threatening, and it requires an immediate treatment.
What are the regular treatments of hernia?
Well, if we go back again to what is a hernia, so there is a hole and there are contents which are coming out from inside the abdominal cavity to the outside. Now, to rectify this problem, the only way, since it is an entirely mechanical problem, the only way is surgery. So, the simplest answer to the question is there is no alternative to an operation for hernia. And what we do in the operation is we free up the structures which have come out outside the muscle wall. We free them up. We release them from the hole. We push them all back to where they are supposed to belong. And then we seal the hole with a non-absorbable permanent net, which the common term for that is a mesh. This is the treatment for hernia. Now, this has to be an operation. There is no medicine that can do this work. So, the answer to the question is, what is the treatment for hernia? Is surgery. However, I would like to add that it is very important to select the patients who are offered surgery. Hernias in general tend to happen in middle-aged and elderly people. And we also would expect that these people are going to have comorbidities. Like they will have hypertension, they may have cardiac problems, they may have pulmonary problems, and operation may be risky. So if, for example, an elderly person with multiple comorbidities and having a hernia which is not causing any serious symptoms, that is, the patient does not have any pain, is able to do their normal activities without any discomfort, you might not want to operate on them just because it is a hernia. You might just want to observe them and think of surgery as and when they start getting problems, which they may not get ever in their life. So either you operate or you observe. There is no third treatment for hernias.
Okay. What are the different types of hernia operations, if you could elaborate?
Right. There are multiple types of hernia operations, and also there are multiple types of anesthesia that can be used for hernia operation. Now, to put it very simply, we can divide the operations into two types. One is the traditional open surgery, and the other is called the minimal access surgery. I'm using the word minimal access because minimal access now encompasses two fields. One is the laparoscopic, which is there are other words for it. We can say microsurgery. So, but laparoscopic surgery. However, minimal access now involves robotic surgeries also. So you have open surgeries and you have the minimal access surgeries. The open surgeries essentially makes a 4 to 6 inch cut over the hernia, wherever it is, directly on top of the hernia, frees up the hernia, pushes the thing back in through the hole, and then seals the hole with a mesh. Whereas in minimal access surgery, the same operation is done with small cuts. On 99% of cases, we require approximately 3 small cuts. The largest cut is about 10 millimeter, and the other 2 cuts are 5 millimeters. And these cuts are made not on the hernia directly. They are made separately from the hernia, further away from the hernia in the abdomen through normal abdominal wall. And the repair in that case also is the same. You free up the hernia, pull it all back in, and cover the defect with a mesh. So this is the minimal access technique, and you have the open technique. What is more important and is more interesting, at least to me, is that the different types of anesthesia. Now, if we are opting for a minimal access treatment, we don't really have an option other than general anesthesia, because minimal access operations cannot be done other than general anesthesia. But if it is an open operation, we do have other types of anesthesia possibilities. One of that is a spinal anesthesia. Spinal anesthesia is an injection which is given into the spine, and it numbs or anesthetizes the lower half of the body and it is very convenient for any surgery that is done, say, the belly button level and downwards. And this is very useful for people who have chest problems, lung problems, breathing problems, where general anesthesia can be dangerous. So spinal anesthesia is very, very useful for people with lung problems. The other one, which is something that is very close to my heart, and I do a lot of cases, is doing a hernia repair under local anesthesia. The good thing about local anesthesia is that people who have cardiac problems, the people who have lung problems, their lung condition or the cardiac condition doesn't get affected at all by local anesthesia. We just make the area of the hernia numb and we repair the hernia without any effect on the rest of the body. But again, for spinal anesthesia, local anesthesia, the hernia repair has to be an open technique. It cannot be a minimal access technique.
Are there any restrictions after the surgery, and if so, for how long?
Yes, every hernia operation will have some restrictions. The restrictions are variable depending upon what type of technique has been used. The initial few days, people are advised to stay at home. They are fully independent, but it doesn't involve bed rest, I must add. They are allowed to do all their normal work like toilet walk. They can walk around on level ground. After this short period of time, they are allowed to go back to their normal office work. They can climb up and down the stairs, but to avoid any strenuous activity like going to the gym, cycling, running, riding a bike, avoiding low chairs, low beds, that too for a variable period of time, and then they go back to completely normal activity. What I'm trying to say here is that there are restrictions, but they are all temporary. There are no permanent restrictions for the length of your life. For minimal access operations, I would advise restrictions for approximately a week. For open surgeries, I usually I advise restrictions for about 6 weeks.
Right. So before we conclude, sir, again, we would like to conclude on a positive note. So the basic idea of hernia is now known to people who are watching this, and there's nothing to be afraid of. So what are the basic things that we can do to lead a healthier life, and is it possible to avoid hernia in any case?
Certainly. I think very simple. Lead a healthy life summarizes the whole thing. Do your exercises, maintain your muscle tone. That is what protects against hernia formation. Avoid obesity, eat healthy, exercise regularly, and at the end of the day, if you still find a problem, consult your doctor. It is a curable disease. It's nothing to get afraid of. The treatment is pretty simple and the success rates are very, very good.
Thank you, sir. And I believe if our audience has further questions, they would direct it to us. Thank you again for sharing your valuable time with us. We hope to connect with you again soon.
Thank you.